Hi, this is Dr. Tim Dunne, and we're at Advocate Integrative Medicine, and we're having a fireside chat with our nurse practitioner, Dr. Holly Dockery, and I wanted you folks to see what our conversations are like so that we take away the white jacket cloak that so many times is seen in healthcare. So Dr. Holly, how did you get into healthcare?
Well, I got into nursing well over 10 years ago, and I started out as a nursing assistant. I then went on to obtain my bachelor's degree in nursing, where I worked at the bedside in acute care settings, and then I went on to obtain my doctorate in nursing practice, and I became an adult and geriatric nurse practitioner.
So your focus is in geriatric. It's some of our older folks.
Yes, yeah. My primary experience has been in older adults, 65 and up, but I also have a lot of experience with young and middle adults as well, 20s, 30s, 40s. So.
Okay, so what really drew you to the older population?
Honestly, it was a lot. That population was who I had experience with. Taking care of people in the hospital are typically older. I never did pediatrics, I never took care of children, and I just grew to love taking care of adults and complex disease needs. A lot of times as you get older, you have aging processes that play into your health needs, and that differs from your younger adult. And so, yeah, I just got really used to it and really enjoyed it. I enjoy learning things from my patients as well. And I think there's a lot of wisdom to gain from your older adults.
It sure is, sure is. We're here at Advocate Integrative Medicine. We're trying to do things more holistic than what we typically see. So when we look at our aging population, we're going to see a lot of those in here because we primarily focus on joint and arthritic degenerative changes. What are some of your thoughts on the chronic disease side? How can we help them from our approach here?
Well, definitely looking at health promotion and prevention. We need to be looking at diet, reducing inflammation, and adequately managing comorbid disease processes so that each one can be well controlled individually. It's not just you have one problem and we fix that one problem. We really need to look at how every problem you're having is associated with one another and getting to that root cause so that you can function better overall. Exactly.
And right now, dealing with COVID and all of our fears, we know that COVID is an RNA-based virus. So our first line of defense needs to be our immune system.
It definitely does.
Instead of us being so afraid of what we're dealing with, we know what we're dealing with.
Yes.
So then we're looking at a lot of our patients are having low vitamin D levels. And then we look at supplementing vitamin D with zinc and vitamin C. So that's one of the things that we hope to give you folks is a team approach where all of us are communicating with each other so that you get many opinions at the same time for one cost. And that, folks, is what really makes us different. So moving forward, you have some openings, some appointment times. Who, if you were to give our audience your favorite patient, who would that be? What is it that you're passionate about treating?
I would love to see anyone, an adult, if you want to be in your 30s, 40s, 50s, 60s, 70s, 80s, 90s. I've treated people older than 100 before. I want to see those people who are interested in improving their own health, and I want to be able to help them do that. So
it sounds like your focus is on them thriving.
Yes, absolutely. We have a lot to live for, and if you want to take care of yourself, we can definitely get you feeling good.
All right, folks, you heard it from the doc. She's telling you if you want to live and you want to thrive and you want the life that you hope for, she's the one. Give us a call, make an appointment with her, and let's start that process of healing and invigorating and regenerating and get your life back to where you want it to be. Call Dr. Holly today.